First question. The urinary output of a client for 24 hours was 350 ml. The nurse has documented the observation as the option A, anuria, option B, polyuria, option C, dysuria, option D, oliguria. The correct answer is option D, oliguria. Oliguria is the urine output less than 400 ml per day. Normal urine output is 2000 ml per day. The option C, dysuria. Dysuria is the painful urination. Polyuria. Polyuria is excess or abnormal large production of urine. The output more than 3 liters per day. Anuria. Anuria is the urine output less than 100 ml per day. Next question. Which one of the following terms indicate increase in size of cells without increase in number of cells? Which one of the following terms indicate increase in the size of cells without increase in number of cells? Option A, hyperplasia, option B, hypertrophy, option C, dysplasia, option D, atrophy. The correct answer is hypertrophy. Hypertrophy is the increase in size of the cell, and hyperplasia is increase in the number of cell. Option C, dysplasia. This is the loss of the uniformity of the individual cell or loss of architectural orientation. Option D, atrophy. Atrophy is a decrease in size of organ caused by disease or lack of use. Question. When the client can breathe only in upright position, it is termed as option A, orthopnea, option B, dyspnea, option C, tachypnea, option D, apnea. The correct answer is orthopnea. The orthopnea is the condition, the shortness of breath that occur when patient lying flat. So the patient have to sleep propped up position in bed. Next option, dyspnea. Dyspnea is a sensation of breathlessness or shortness of breath. Tachypnea. Tachypnea is the respiration rate more than 20 breaths per minute. This is the case of adult. In newborn, tachypnea is the more than 60 breaths per minute. In case of infancy, the respiratory rate more than 50 breaths per minute, considered as tachypnea. In case of toddler, the respiratory rate more than 40 breaths per minute is tachypnea. In case of children, the respiratory rate more than 30 breaths per minute, considered as tachypnea. Next option is apnea. Apnea is a respiratory pause of greater than 20 seconds or cessation of respiration more than 20 seconds. Next question is, a client after pneumonectomy will be positioned on. A client after pneumonectomy will positioned on Option A, supine position only. Option B, supine and either sides. Option C, operated side or back. Option D, unoperated side or back. The correct answer is operated side or back. Rationale is the advise patient to lying on affected side or back and avoid on the healthy side to prevent pressure on the healthy side of the lung tissue, which will affect the respiratory and circulatory function. A client with hypoventilation is prone to develop option A, metabolic acidosis, option B, respiratory acidosis, option C, respiratory alkalosis, option D, metabolic alkylosis. The correct answer is option B, respiratory acidosis. ABG. pH, the blood is 7.35 to 7.45. Partial pressure of oxygen 80 to 100 mm of Hg. Partial pressure of carbon dioxide 35 to 45 mm of Hg. Carbon level is 22 to 27 milliequivalent per liter. Remember the values. First is the respiratory acidosis. I try to discuss how to solve the ABG value questions. Respiratory acidosis. What happened in respiratory acidosis? In respiratory acidosis, the oxygen level, the oxygen concentration is decreased and carbon dioxide level is increased, and H plus ion increased. The excess amount of the carbonic acid lead to acidosis. So the respiratory acidosis is the H1 H plus ion, hydrogen ion increases, the pH value will decrease. In case of acidosis, pH is decreased. In respiratory acidosis, the pH decrease and PCO2 value, partial pressure of carbon dioxide, increase. The value more than 45 mm of Hg. Once again, the respiratory acidosis, the pH value is decreased. The value less than 7.35 and increased partial pressure of carbon dioxide more than 45 mm of Hg. Causes of respiratory acidosis. The first one is asthma. Second is brain tumor, bronchitis, atelectasis, pulmonary edema, emphysema, hypoventilation, pulmonary embolism, these are the main cause of respiratory acidosis. Respiratory alkalosis. In alkalosis, the pH value is more than 7.45. Increased pH means alkalosis and decreased pH means acidosis. In respiratory alkalosis, the pH value is more than 7.5. That means the increased pH and decrease PCO2. Causes: fever, hyperventilation, hysteria, overventilation by mechanical ventilator, hypoxia. These are the main causes of respiratory alkalosis. Metabolic acidosis. Metabolic acidosis. In metabolic acidosis, we focus on the pH and bicarbonate. In metabolic acidosis, the retention of too much acid, so it leads to acidosis and wastage of bicarbonate and increased hydrogen ions. So increased hydrogen ions means decreased pH. Decreased pH means acidosis. In acidosis, all acidosis, the pH value is decreased. The value is less than 7.35 and decreased bicarbonate level. Value is less than 22 milliequivalent per liter. Causes of metabolic acidosis. The causes are diabetic ketoacidosis or diabetes mellitus, high fat diet, insufficient metabolism of carbohydrate, malnutrition, severe diarrhea, renal failure. These are the main causes of metabolic acidosis. Next is metabolic alkalosis. A loss of hydrogen ions, so the pH value will increase, and accumulation of bicarbonate, so the value of bicarbonate more than 27 milliequivalent per liter. Causes of metabolic alkalosis. First is use of diuretics. Excessive vomiting, hyperaldosteronism, in excessive injection or infusion of sodium bicarbonate, and massive transfusion of whole blood.